This is what Dr. Peter Juni, Dr. Abdu Sharkawy, Dr. Eileen De Villa, Dr. Lawrence Loh, and Dr. Vera Etches talking about, and Dr. Peter Juni and Dr. Abdu Sharkawy warned us about this like almost a month ago, and yet people are so stubborn to think, oh, cases wouldn't get too serious. So whenever people if they say something like that, it's always jinxed. Start screaming. So, get ready. Coronavirus cases today are at 4,227 cases. It's not combined. It's not a combined case. It's like a single daily case. It literally went up the steep ramp, and look where we're at. Oh my God. Oh my freaking God. And to those people who thought it's nothing right now, this is why we are having a second lockdown. This is why we're having a second stay-at-home regulations. And this is why non-essential businesses are only at curbside service now. Since yesterday. So we have 3 regions in the high cases category. Toronto with 1,663. Peel Region with 762, and York Region with 532 high cases. So 247 is from Durham Region, 246 from Ottawa, close, literally one behind. 174 from Halton Region, and 159 and from London-Middlesex Region. All other regions reported under 150. Okay, so now all the other regions reported under 150. So last time it was under 120, and now it's just jumped up 30 more. Honestly, this is not good. This is not getting any more, it's getting worse and worse and worse. Eighteen deaths have been reported today. And a first order of matter of order, UK variant cases. So I could be wrong about this one. Yes, yesterday they showed Global News gave us the wrong number. I think they might have gave us the wrong numbers because the numbers were suspiciously high, and there was like around 2,200, and then yesterday they showed us 9,632, and so like, hold up, cases can't go like that high. So I will have to bring out the calculator again. So yesterday with 3,000, I calculated 3,608 yesterday. So plus that. Plus the number they gave us today with plus 1,860, so that's 1860 equals. So the official actual number would be around 5,468. Because there is absolutely no way cases could be that high. Unless if the variant cases are like literally double double the regular of the number of the daily cases. But safe to say, I'll just go with the news what they showed us. But this shows us that the UK variant is at number 1, Brazilian variant is number 2 at with 133, which is a +2 compared to yesterday's number, and 76 from. And third place is the South African variant, with 76, which is a +1. So, the South African variant, that used to be in the second place spot. And then the Brazilian variant somehow increased higher than before. And this is really dangerous. So if the number is at 11,000 plus, and the Brazilian variant is like literally above 100, you know what trouble's going to happen. So, to report on how Ontario's big box stores are looking at, since the big box stores can only sell essential items, unlike the first lockdown, where they could sell these items, much to the disappointment of personally owned businesses that do sell non-essential items and such. But this time the businesses, though the non-essential items selling businesses can profit, but only by curbside pickup. So let's look. So reach Walmart. So Walmart is putting out some essential items like toilet paper, hand sanitizer, and disinfecting wipes, and the disinfecting wipes. Like Lysol and other companies that make that disinfecting wipes in front of entire sections of the store. So like. Because some people might go like into the aisle to try and grab as many as possible. So like yeah, really. And in an effort to restrict customer access, like so, and other areas were blocked off with yellow caution tape. So dozens of blue boxes were also seen blocking off a clothing section at Toronto Walmart locations. So locations could because they're forced to not. So a Toronto Costco store used clear wrapping. I've seen them use this all the time. Whenever I go to Costco, to block entire sections of non-essential goods. So some items were grouped together and blocked off. So excellent. So many non-essential retail stores either closed entirely or switched to curbside pickup or delivery. So it's not only essential items like food, pharmacy items, and household cleaning supplies can be sold. From these places. So yeah. So I am looking at like a photo right now. I can put the link down below for you guys just to see it. Walmart used caution tape to literally block a whole bunch of items. Wow, smart idea. And then you use pallets to block off the clothing section. Okay. Nice. And they also blocked the clothing section off with cashmere toilet paper rolls on top of several pallets. Okay, that's good. That's a good idea. And of course, they blocked off like the whole bunch of other stuff. And then the blue bins. And Costco using, that's, Then, yeah, they're also covered with books. And whatever those are. So they literally blocked them all off. So people can only buy essential items only. So smart idea. So just to say, okay, I made a mistake yesterday. I actually calculated it again and using my Outlook calendar, and I found the stay-at-home order is It's from yeah, it's from starting yesterday, April 8th to May 5th. May 5th is the last day. So people are only to go out for work, school, shopping for groceries, pick up. Please leash your dogs at all times if you're going to walk your dog. I've seen people who are breaking this rule, and this frustrates me, because they're pooping all over the place, and owners don't stoop and scoop when you should. It's a bylaw. And public parks are available stuff, but that's most likely that is closed up because of the stay-at-home rules. So that canceled out the lockdown rules. So non-essential businesses can only do curbside pickups or closed entirely, and the big box stores will only have aisles open, like mentioned. Schools are still open except the regions with schools temporarily closed due to case issues, which is the Toronto, Peel region, and Guelph. So eviction will not be happening until the lockdown ends. So May 6th, then it'll start happening. So education workers who provide support for students with special needs and also in high-risk areas will be eligible for vaccination in the Toronto and Peel region during April break, and after that, York region, Ottawa, Hamilton, Halton region, and Durham region, and the rest of Ontario will get it after more vaccines roll in. So hotspot committees, if you're wondering what they are Durham region, Halton region, Hamilton, Niagara region, Peel region, Ottawa, Simcoe, Muskoka region, Southwestern Ontario, Toronto, Waterloo region, Wellington, Dufferin, Guelph region, London-Middlesex region, and York region. So the lockdown, as a reminder, is from April 3rd to April 23rd is the last day of the lockdown. After April 24th and April 24th, after that, will still be under stay-at-home rules. So I revised these rules up sort of bit to fit the stay-at-home rules. So notice any changes? Yeah, I made some changes. So hospitalizations, oh my. Hospitalizations right now are that 1,492 hospitalized with the virus, plus with the plus 75, 552 ICU patients, plus 27, 359 ICU patients using a ventilator, plus 28. So ICU patients are going increasing, and this is not any good. So especially the variant cases, especially the UK and Brazilian. So okay. Schools. Oh no. So we have 14,686 school-related cases from schools. This is from 1,300 schools out of the 13,828 schools. So which is 20. 27%. Wow. It's almost going close to like 30% of the entire school number of the schools in the entire Ontario province. So 11,077 is from students, 2,477 from staff, 1,162 is from unknown individuals. So, still, schools closed are in Toronto, Peel Region, Guelph, until April break. So schools, so April break, it starts next week. So next week, we won't. So students will go to school on Friday, and then that's the last school day, and then until so the April 12th to April 16th, Monday April 12th to Friday April 16th. That's entire school week. Yeah, April break. So they're not going to school, but that they have to follow stay-at-home rules and lockdown rules. And then schools will be open April 19th. We'll get reports where what schools will be closed because so long-term care home deaths is still at 3,755 since Monday, and haven't changed. So and the outbreaks number is at 46 now, so that's -3, so that's good. Okay, so here's how it's going to go. So if you really want to think things better for all of us, especially the alarming high UK variants, which is apparently, I think, surpassed the coronavirus daily cases, and especially the UK variant and Brazilian variants are two variants that are stronger than and they're deadlier and contagious than coronavirus that you should be actually be alarmed about, and so please follow coronavirus safety rules and regulations, lockdown regulations, and also stay-at-home rules. So do not have any gatherings of any kind, because you know what happened every time people had gatherings for certain celebration days or holidays or statutory holidays, or cases went up. And especially when in the UK variant, South African variant, and Brazilian variant came into play, things got even worse. So at least 20% of coronavirus cases from a certain gathering, 20% of them were UK variants or South or other variants. It's that serious. So, stay safe. Don't make things worse for any of us. We're already in deep water. Cause we are like literally above we jumped over the 4,100 coronavirus cases line, and we're in the 4,200s. That's like no joke. This is when we start seeing high cases and people getting more affected more, and we need to vaccinate as many people as possible, and people need to comply to following coronavirus rules instead of acting like complete stuck-ups and trying to act like your priorities are higher than everyone's health regions. Like, oh, my rights, yeah, my rights. I don't care about following rules. I ain't gonna do lockdown. There have been several people who acted that way, and those are the people who are like anti-vaxxers and anti-lockdown people, and technically anti-coronavirus people who are making it worse for all of us. Because the virus and especially the UK variant, which is ridiculously at least 2.2 times higher. Well, actually, like almost 3 times higher than regular cases. Today's cases. Yeah, they're going to. So it's the UK variant that got us here, where we're at right now, with the lockdown, second lockdown. And also stay-at-home rules, which should have been applied since day one of the lockdown. Because in other countries, people actually complied. They followed the rules. It worked. We need to do the same. It's time we learn from others, like certain European and Asian countries that have also learned to comply with these rules and stricter regulations. It's time we do it too. Doctors and health care professionals warned you guys, but you didn't listen. It's time you start being woke and wake up. Because coronavirus and the variants, they don't care about like what gender you are. They don't care about what race you are, what religion you are, where you live. The only thing that they're gonna do is try to kill you all. So we gotta, try to beat the virus by following coronavirus safety rules. And follow other like regulations and rules. Vaccinate people as fast as possible, and it's just gotten like we're really in deep water, and there's no way we're going to go get back.